tubes are used in veterinary medicine for both short-term and long-term needs. We use feeding tubes when animals are not eating for extended periods of time, when animals are recovering from intestinal problems, post-surgical problems, and chemotherapy. Feeding tubes are used because they're much easier than syringe feeding animals, and we're able to get the proper amount of nutrition into animals for both health needs as well as healing. Two different types of feeding tubes used. One is placed in the esophagus, an esophagostomy tube. The other is placed in the stomach, a percutaneous gastric tube. Today, we will go over how to use the tube, care for the tube, and troubleshooting problems with the tube. Caring for a gastric feeding tube. The gastric tube is kept in place by a small stockinette either around the abdomen or made into a t-shirt. The tube should be evaluated daily for signs of redness, swelling, discharge, or pain. We remove the stockinette and a piece of gauze is kept in place. Removing that daily, we evaluate the tube site for any swelling, redness, or discharge. An aseptic cleaning pad is used to sweep around the tube and clean any discharges, replacing a clean, sterile gauze under the feeding tube, and then keeping the tube in place by the stockinette. Using the feeding tube. The amount and type of food will be determined by your veterinarian. The food is used in a moist form mixed with water to make a gruel consistency. Using the feeding tube.
When you're going to do your feeding, you'll need to remove the stockinette to expose the peg tube. At this time, you'll draw up your feeding. Here we have 15 mLs. We want to pinch your peg. Then you'll open your small port, apply your syringe to the port, and unkink the peg tube. You want to administer a couple cc's at a time. You want the total feeding to be over 10 to 15 minutes. While you're doing the feeding, you want to watch the patient for licking lips, breathing heavily. If at any time that occurs, then you want to slow down your feeding. If at any point the pet vomits, you want to stop. Troubleshooting the peg tube. If you come across the peg tube not working, if it may have a clog, there's a couple things we'd like you to try before notifying the veterinarian. You can try by pinching off your tube and hooking up an empty syringe to the port. We're going to try and unclog it by drawing back any food or water that you may have administered, hopefully trying to get the clog out of the tube. So gently just pulling back. As you can see, I'm getting food back. And then once you get some food back, you want to pinch off your peg tube again, and you can try giving the feeding or the water again to see if you alleviated the clog. So then we would hook that back up and gently go with the water or food. If you're still finding resistance, then you can try with just water, trying to pulsate the clog maybe out of the tube. You want to do this gently, but just kind of little higher pressure pulses, hopefully breaking up that clog. If we still are having resistance and not being able to use the tube, you can purchase some Coca-Cola and draw up 6 cc's of that and administer it into the tube and let it sit there for about 20 minutes. At that time, you want to draw back the Coca-Cola and try and do your feeding or some water to see if your tube has become unclogged from the Coca-Cola. If at that time you are still having issues with the tube, go ahead and notify the veterinarian.